Hello, I'm Dr. Carolina Medina from Coral Springs Animal Hospital, and I'm here today to talk to you about shockwave therapy. Shockwave therapy is a high-focused energy sound wave therapy that stimulates the tissues by mechanical energy. So the sound waves come from the machine through the trode and create a mechanical force directly into the tissues, creating a biological response at the cellular level. And primarily what it does is it decreases inflammation, promotes neovascularization, and cellular proliferation. So primarily the benefits that it has is to decrease pain and inflammation, to speed wound healing, and to speed the healing of tendons, bones, and ligaments. So you have two trode options. You have the 5mm trode, which is this one here, which is a smaller probe. It's a little bit more kind of narrowed and focused. And this trode is going to be used primarily for most body parts for small animals, so all of the distal joints and also for any wounds. And then this one, you see it's more kind of flattened and wider. This one is better for larger muscle or larger body parts like the shoulder joint and then the hip joint as well. So the patient that we're going to work on today has elbow arthritis, so we're going to use a smaller 5mm trode. So to plug this in, you lift this cap and insert the trode with the flat part facing away from the machine. So you insert it just like so. Once you insert the trode, you'll see that it'll tell you the trode, the number, and then which trode you have in. So this is the 5mm trode that we selected, and then the number of pulses left. So this trode has about a little over 50,000 pulses left in it. There's two options. There's the manual setting and the preset setting. So if we go to preset, you can see there's small dog, medium dog, large dog, and horse. So you select the dog that you're working on. And then you have 4 treatment types. Bone, which is used for fracture healing, tendon and ligament, chronic pain, which is used for osteoarthritis, and then wound. So let's say we're going to do tendon and ligament, and it will populate out the preset for you. So this is set at energy 6, 750 pulses, and 360 pulses per minute. So it's already calculated out for you. The other option is if you want to do it manually, you would go back to the main screen and hit the manual button. And so here you can program it to whatever you like. So if you look at the recommended settings from PulseVet based on various studies that have been done, you can see the different body parts and the settings that they recommend in addition to what trode they recommend to use. So the patient that we're going to work on today has elbow osteoarthritis, so we're going to deliver 800 pulses. And we can do an energy level anywhere from 3 to 5. So we're going to select 5 for her. And what I like to do is when I have a patient that I'm going to do a joint on, that I'm going to do pulses both medial and lateral, then I go ahead and do half on either side. So we'll go down to 400 pulses, energy level of 5, and we'll leave it at 360 pulses per minute. So when we apply the settings, it's going to deliver energy level 5 for 400 pulses. So we can do that on the lateral side of the elbow, and then we'll repeat that same setting for the medial side of the elbow. And then to start it, we would basically hit the flick button. So once we hit the flick button, the trode will start delivering the pulses. But first we need to prepare the patient. So as you will soon hear, the shockwave machine is quite loud, so it does require sedation for 2 reasons: for the sound, and also when you're actually delivering the pulses at the time, it is uncomfortable, but it's pretty much short-lived, just when you're delivering the pulses, and then after that, the patients are okay. So we have her sedated under dextromethorphan and butorphanol, and we just have some oxygen flow by for safety purposes. And so you want to shave the area that you're working on, so you can see that we've shaved the elbow. And you put some ultrasound gel. Want to make sure you have nice coverage. And then before you start, you want to shake the probe to make sure that you move the crystals around in the trode and make sure that they're evenly dispersed. So you can also tap it. And then you're ready to start. When you start, you want to press the flick button to start delivering the pulses. So we'll put move the gel around, make sure it's got good contact, and then we'll start. And so the machine stops the pulses when it's delivered the set pulses. So it's delivered 400. So now we can clean this side and flip her over and then do 400 immediately. So that way we delivered 800 pulses total for the elbow joint. In general, we do about 1 to 3 treatments and spread them out anywhere from 2 to 3 weeks apart. So it really just depends on what condition you're treating. So primarily for the osteoarthritis cases, I typically tend to do up to the 3rd treatment, especially if it's the elbows. Usually those do require the 3 treatments. And then a tune-up anywhere from every 3 to 6 months for the elbows. The stifles and hips actually, you can get a longer treatment time. So usually those will be anywhere from 1 to 2 treatments. I would say more commonly 2 treatments, especially if it's a more moderate to severe osteoarthritic patient. And then those typically require a tune-up anywhere from 6 months to 12 months. So the elbows, I think just because it's a less forgiving joint, they do require a few more treatments and more frequent tune-ups than others. For the tendinopathies, most commonly I would say you're going to do this on the calcanean tendon or the biceps. And those usually can be anywhere from 1 to 2 treatments for mild cases and then 2 to 3 treatments for severe cases. Usually those don't require a tune-up, but maybe the severe cases, if they re-injure it with some activity, they might need an additional treatment as a tune-up. For the fracture healing cases, primarily 1 or 2 treatments depending on where they are in their repair phase. So say, for example, if you have a patient that you did a fracture repair and you take radiographs 8 weeks later and there's still not enough healing, then do a treatment and then recheck x-rays in 4 weeks and see where you're at there. So you might need an additional treatment. And then the other thing that I've been using it kind of more in the past few years for is for subluxation of the first rib heads, especially in very large dogs that it's going to be hard for me to manually adjust that. Then I'll go ahead and do shockwave first and then follow it up with manual adjustment. And most of the times those cases only require 1 treatment. So I've been using shockwave since 2010 and I've been very pleased with the results. I would say I primarily use it for osteoarthritis, especially of the elbows, stifles, and hips, as well as tendinopathies, primarily calcanean tendon injuries, use it quite frequently for that. Shoulder injuries, so whether it's due to instability, inflammatory conditions, or even calcification, shockwave can be very beneficial for. And then also fracture healing and wound healing. So once you've completed the treatment, the way to turn off the machine is first to start by removing the trode. So pull tight to remove the trode. Put your cap back on, and then it'll tell you no trode detected. So that way you know you've done it securely, and then you would just unplug the machine and it would turn it off automatically. But it's very important to remove the trode prior to turning off the machine because you won't be able to remove it if it's still in the machine when the machine is off.